So good afternoon, everybody, and thank you so much for joining the California Collaborative for Long-Term Services and Supports as we explore the challenges and opportunities in equitable digital access for California's older and disabled adults. Just a couple of reminders before we get started. First, closed captioning and American Sign Language interpretation is available. To enable captions, you'll want to select the CC or transcript icon from your Zoom toolbar. Meeting materials, including the session recording and slides, will be posted to the Collaborative's website at www.ccltss.org. And lastly, chat is enabled. We encourage you to engage with presenters, friends, and colleagues throughout the presentation, but please remember to be courteous. Anyone who abuses this feature will be promptly removed from the session. Our agenda today includes two presentations focused on the digital divide, topic that's been increasingly at the forefront of policy discussions as some of these challenges were highlighted by the pandemic. To set the stage, I just want to kind of talk a little bit about the digital divide. So according to the Pew Research Center, the vast majority of Americans utilize the internet in some way. In California, broadband access has been steadily growing over the past several years. In 2017, 74% of California households had high-speed internet, and that share grew to 84% in 2019. Even more recent data from the USC and the California Emerging Technology Fund highlights a new milestone with nearly 91% of California households having access. But despite these gains, many Californians are caught in the digital divide. There are disparities in access for Black and Hispanic families. For example, nearly a quarter of Hispanic families are either unconnected or restricted to smartphones, and that compares to 5% for white families. There are disparities among households headed by those aged 65 and older, where 23% lack broadband compared to 10% of Californians ages 50 to 64 and just 5% for ages 18 to 49. People with disabilities also have lower rates of access. 27% are either unconnected or underconnected, meaning that they solely rely on their smartphones for internet access. And there are geographic disparities. Adoption rates in the Central Valley lag far behind the Bay Area, although this is clearly both an urban and rural issue alike, with Los Angeles only slightly outperforming the Central Valley on access. Income is also a major factor. Despite being the fifth largest economy in the world, California has the highest number of individuals living in poverty. I think we're on the next slide, Nancy, or did we jump ahead? There we go, thank you. 29% of households earning less than $40,000 per year have no internet connection or only have access through a smartphone. So with that, we're so excited to welcome our colleagues from ITEP and the California Department of Aging for today's conversation. First, I'd like to introduce Katie Hydorn, who's the Executive Director of ITEP. And for the past 18 months, Katie and her team have been leading the way in bridging the health and broadband community. Today, Katie is going to dig a little bit deeper into the landscape and talk about some of the investments and opportunities in this policy area. Thank you.
All right. Maria, can I take it from here?
You can, yeah. Nancy, would you mind spotlighting? I'm not seeing that feature on my end. Oh, already there. Thanks, Katie. Go ahead.
Thanks so much for the great introduction, Maria, and for the great framing. Those slides are awesome. Hi, everyone. As Maria said, my name is Katie Hydorn, and I'm Executive Director of Insure the Uninsured Project, or ITEP, as we call it. And I'm just so pleased to be here today to share some of the work and to continue to build on the partnership that we've started to create with Maria. This is just such a wonderful opportunity to be here today, and I can't wait to share my information and hear your questions. So just a little bit about my organization first. We are an over 25-year-old health policy nonprofit and convener. Our mission is to promote innovative and workable policy solutions that expand healthcare access and improve the health of all Californians. We believe that all Californians should have a fair opportunity to live their healthiest lives. Next slide. Our values, we seek a health system that is universal, equitable, accessible, effective, and affordable. Next slide. And we have 3 policy priority areas. So we have coverage and access in keeping with our original mission to ensure everyone and make sure that they have access to healthcare. And then we've added delivery system transformation, making sure that that coverage actually works for the person and is meaningful. And then we have a bucket that we call the future of health, which is really boiled down to technology and data. And for us, that's really where our broadband and connectivity work fits in. Next slide. So the real question is, why should health and human services focus on broadband? Really, I believe, and I know my colleagues here believe, that this is the future of healthcare and the future of healthcare innovation. And it will be grounded in technology and connectivity. And so you can see here on our pyramid, we have equity and affordability at the middle of all of this. We need to make sure everyone has that baseline opportunity to have connectivity, that it's affordable, that it's fast enough to actually enable meetings like this and allow you to do presentations, that people have the right devices. Maria just gave you a lot of data about internet access via smartphones, but smartphones, tablets, laptops, desktops, etc. And then also making sure people know how to use those devices and actually access sort of the digital world and navigate around it. And that's what we call digital literacy. So really 3 legs to our stool here: connectivity, devices, and digital literacy. And our goal is really to achieve the potential of telehealth and virtual care, of data exchange to enhance healthcare access, and of course to promote equity. Next slide. So a little bit more here displayed in a different way, but we really believe broadband is a social determinant of health. It really addresses other social determinants of health as well, including economic mobility and education. It's our opportunity to really look across all, I think, social drivers of health and really connect up at that higher level. One of our partners recently said that broadband should be as ubiquitous as air. And I thought that was really an exciting way to put this. Next slide. So Maria talked a little bit about this, but just a few more consumer impacts. So this really does impact people. And the COVID pandemic really underscored, as it did, shone a light on many inequities, but really showed that we have a long way to go actually in terms of connectivity. And I think the maps that Maria showed are really important to say that it's not just a rural issue. It actually impacts suburban and urban communities as well. I think from her data, LA was right behind the Central Valley in access and connectivity issues. So a few factors here, right? Slow broadband speed. The federal government has set a 25 up, 35 download megabits per second speed. I have a slide later that will show you that that's barely enough to do just basic what we're doing now. I think last time I was at a conference, they told me that they wanted a 5 megabits per second upload speed. That's higher than the 3. That's the standard. So not only are 20% of California households not meeting that standard, it might not be enough to engage in a digital world. When I think about telehealth and virtual health, I'm really thinking about not right now, but really building for 10, 15, 20 years out. Only 66.5% of households have broadband speeds of at least 100 megabits download speed. So again, lower broadband speed than what's really necessary in this day and age. And just a note here, Maria highlighted this, Black and Latinx seniors are really 2.5 and 3.5 times more likely to lack connectivity. So major racial and ethnic equity issue here as well. Additionally, lack of affordability. 30% of Californians don't have access to low-cost broadband, and even though about 5 million California households are eligible for lower-cost internet, less than that are signing up for these subsidy programs. So next slide, please. We talked a little about the why we should be engaged in broadband, but some of what we're also trying to do for the health and human services communities is to actually talk about what is broadband. So when you actually go and engage in a local infrastructure conversation, or you're listening to me talk, or you're listening to a broadband person talk, what are they talking about? So I really like this visual because you'll hear a lot of this in, if you start to listen into some of the broadband policy conversations. Backbone long haul. These are huge fiber cables that are connecting up major cities across the country and really across the world. They go under the sea. Then we fast forward to middle mile infrastructure. These are like the major interstates. They're big highways. It's like I-5 or I-99, big fiber cables that are in the ground covering long distances that have hubs along them where the last mile plugs in. So think of the hubs as like off ramps from a major interstate. So you get off on an off ramp and that's the last mile into that community. And these are things that, you build a big middle mile thing to, a hospital that we would call it, what's called an anchor institution, or to a university, or to a county building. And then the last mile piece bounces off that and goes into different communities. So backbone, middle mile, last mile. Next slide, please. And then there are different types of broadband and connectivity. So you might hear fiber. That's sort of the gold standard, what we're trying to get everybody to. You might hear something also about lit fiber or active fiber, or there also might be what they call, quote, dark fiber in the ground, which means there's fiber there, but we haven't flipped the switch to turn it on. Many of you probably are familiar, obviously, with phone lines and digital subscriber lines, or DSL. And then, of course, we have cable modem systems. Next slide. So this gets into a little bit of what I was talking about. More is faster. So you get kilobits per second, megabits per second, remember here, that 25 megabits download speed and 3 megabits upload speed. But we can sometimes get into gigabits. So more is faster. Next slide. And I really like this slide. How much broadband speed do residents really need? The standard is 25 upload speed, 3 download speed. Well, you can see that that's not going to get you very far. Maybe it gets you into medium usage, but if you're like me and you have multiple people in your household all trying to stream or do work at the same time, and really as we think into the future and what the demands within our households and businesses are going to be, we really need more than 25 megabits per second upload speed. We really need at least 50 megabits per second and probably more. Next slide. So broadband infrastructure in communities. I think that this is really important from like an organizational perspective and where you all fit in this and where your organizations fit. The broadband community, as I said, has these things that they call, quote, anchor institutions. You might be a pillar in your community. Maybe you're a community center, or you're a hospital or a clinic or something like that. There are these, you can be a hub called an anchor institution. It's defined in statute, and you can actually get money from the California Public Utilities Commission to help build that fiber infrastructure from these anchor institutions out into your community. So you build middle mile infrastructure to the anchor institution, then you build last mile infrastructure out into the community from that anchor institution. It's really exciting. Unfortunately, what we're finding is that the broadband community thinks that the health and human services community is already engaged in this conversation, that they're engaged in their local county and city broadband conversations. But what we're finding as we do our work across the state in the policy community, we are not finding that health is engaged, because the health folks are focused on getting health information exchange happening, getting electronic medical records up online. We weren't thinking about sort of the broader connectivity infrastructure. So the wonderful thing is there's money in this area. I'll talk about that in a minute. Major investments happened during COVID. And there are great opportunities, whether you're a community center or a clinic or a hospital. They even put daycare centers on that list, schools, universities. Really, if you have a building and you're in an under-resourced community, you're probably going to be on the map for being an anchor institution. And it could be really, really exciting. And there are partnerships. The broadband community wants us to raise our hands and identify ourselves. There are opportunities to engage in this conversation. The other piece of this, and this gets us to equity, is digital redlining. So next slide, please. Digital redlining is exactly what it sounds like. There were policies put in place where essentially if you're in lower income, under-resourced communities, you have less connectivity. And that's what these maps are showing you. We just took some maps from Los Angeles. So this shows broadband competition and fiber availability in South Los Angeles, which is a much lower income area, versus Glendale, which is a much higher income area. You know, we're seeing fiber is in that sort of section available. Fiber is available. In that 27 map, you'll see those dark areas colored in that bottom right-hand quadrant. Fiber is available in Glendale, and there's almost no fiber available in South LA and Compton. Next slide. Similarly, just like historical redlining, health disparities and the digital divide overlap, probably not surprising to all of us, right? A lot of the work that we do in lower income or under-resourced communities are in those same communities where you have less connectivity and less fiber opportunities. So we're really trying to make that connection between public health indicators like asthma, you know, trying to make the connection with the lower internet rates along with uninsured health rates as well. Next slide. So what do we do about all of this? There have been some really, really incredible investments just in 2021 and 2022, so right now, that have really made it really important for everyone involved in this to come to the table, whether it's government or education or the jobs community or health and human services community. Most relevant to the health folks, we're actually paying for telehealth now. The state committed in this last budget and just passed the budget about 3 weeks ago to continue telehealth flexibilities in the Medi-Cal program. Our Medi-Cal program serves almost 15 million Californians. And that's incredible, right? We have this group of people who now have access broadly to telehealth. However, then we get into the equity and affordability issue. Do they have the right devices? Do they know how to use them? Digital literacy. And do they actually have connectivity to do telehealth? There's some really great work from the California Healthcare Foundation that talks about how the Medi-Cal population, A, wants to absolutely access telehealth, but B, shows that most of the telehealth visits done during COVID by a group of clinics whose data they analyzed, almost 90% of them were done via phone, via audio only visit rather than a video visit like this because of all of those factors we just described. So we have a lot of work to do here to really make good on the promise of telehealth and really be able to use it as a tool in managing people in sort of the patient experience and managing their care to get better outcomes. So there's money on telehealth for the first time ever, really, in Medi-Cal in a big way. And then the second piece of big money, I imagine you can sense the theme here. California has a broadband for all initiative, and we have had this for several years, but as part of not this year's budget, but the 2021 budget, the governor proposed and legislature approved $6.5 billion. That's billion with a B, to do this middle mile infrastructure project. So all of a sudden we have telehealth money and we have broadband money. And so all of a sudden health really it needs to come to the table to really mature our telehealth work. And then finally, the federal government also invested in broadband infrastructure. So there are $45 billion that states will be able to access from the federal government. And there's a whole stakeholder process that's going to kick off this fall at the state level, run by the California Department of Technology. I know none of us would ever look to the California Department of Technology for anything, but they're the ones who are in charge of all of this really important work. They're going to be creating something called a state digital equity plan. And it's all about making sure that broadband for all happens and that it happens equitably. And health really needs to be in the mix for this. Every single state needs to create one of these state health digital equity plans to access those $45 billion. So our state has submitted our application for the stakeholder process. It should kick off this fall. It'll be about a 9-month process as they create the plan. And I'm really happy to report that we've been doing work with them and educating the folks who are at Department of Technology and their consultants about how health needs to be at the table. And I'm so pleased that their documents and the application that they submitted to the federal government includes a health subcommittee. So very excited to see that, and looking forward to making sure that we all have a voice in that process, because that's really going to determine how those dollars are spent. So what are the big roles for health organizations? What can you do, and what can your organization do, and where can you engage? I'm happy to report that there's a ton of work to be done. I call broadband the gift that keeps on giving, because it's really just an incredible area with so many opportunities. Absolutely, Maria. LTSS stakeholders should definitely be plugging into this opportunity. And if you have questions about how to do that, or how to get your individual organization, or if you're a member organization, how to plug them in, happy to help with that at every level. We have lots of ideas and can connect you to the right people too. So there's an infrastructure conversation, I was saying, this last mile, middle mile conversation. Very different language from, I think, what we're all used to, but it really, really matters. This is where the connectivity lines are going to be built. And so it's critical to be engaged in our community. The education community has a leg up on all of us, because the vendor that the state has chosen to do this project already connects up all of the community colleges and universities, and they're working on the K-12 system. So they're like light years ahead of us. And we've been telling them, hey, you have 400 hospitals, you have 1,000 clinic sites, and you have more, you have our area agencies on aging, you have all of these community resource sites that are all specifically located in under-resourced areas that overlap with all of this digital redlining you're looking at. So they didn't know that any of this really existed and hadn't really connected the dots, really, other than hospitals for the most part. So it's a really exciting opportunity. And they want to hear this too. So at the local level, you can become an anchor institution in your community, or you can just go to the conversations that are happening in your local community and tell them, hey, we're the Health and Human Services folks, and we have people who need to be served by this, and we want a seat at the table. You need to know that our people are the same people you're trying to serve, and we all need to make sure that we're all moving in the same direction on this. So there's local infrastructure builds going on, and you can engage with the California Public Utilities Commission. Just a moment. I'm sorry, I have a child crying in the background. Give me just one moment. I'm so sorry about that. We'll see how this goes. Next slide, please. So immediately you have opportunities to engage at those local conversations. So if you want to engage there are groups that you can engage with, and we can connect you with those folks. There's also a way to get you into something called the Affordable Connectivity Program, which is low-cost internet for people that you serve. Anyone who's Medi-Cal eligible is eligible for this program. So it's really, really exciting. We've got about 1 million Californian households signed up for it, and we've got about 5 million that are eligible. So great opportunities there. Next slide. So at the state level, Public Utilities Commission, California Department of Technology. I have hyperlinks here, but there are multiple public places. If you have lobbyists that you work with, they can engage in these processes. Next slide. And so with that, I'm going to wrap up and kick this back to Maria and then to Brian Carter at the California Department of Aging. But to California Department of Aging, I just want to give a shout out. They're doing phenomenal work. So thank you for that, Maria. Sorry to cut this short. I'm happy to come back at the end of Brian's presentation.
That's perfect. That's perfect. Thank you, Katie. Go run and take care of the kids. I know we had saved some time for Q&A for Katie now, but I think we'll go to Brian. We'll let Katie take care of her child, and we'll circle back to Q&A after. Just want to highlight that the presentation that you're seeing on the screen will be made available after today's webinar, and there is some definitions and key pieces that we're going to skip through for now. Okay, so let's kind of turn the conversation a little bit. I'd like to introduce Brian Carter, who's the Digital Divide Project Manager at the California Department of Aging. CDA has a number of initiatives aimed at reducing the digital divide for older adults. And more recently, the department announced the launch of the Access to Technology County Grant Program. which is a $48.5 million initiative aimed at providing digital devices, broadband service plans, digital literacy training, and supporting digital infrastructure. So Brian, if you could join us to provide an overview of the amazing work that's underway, and then share some ways that we as stakeholders can plug in to ensure equitable digital access, I will pass it right over to you.
Wonderful. Thank you so much, Maria. I appreciate that. And certainly a pleasure to be here with all of you this afternoon. So let me start by saying good afternoon, everyone. I'd like to begin by thanking the California Collaborative for Long-Term Services and Supports for this opportunity to share some of the noteworthy efforts to bridge the digital divide taking place here at the California Department of Aging in response to the governor's executive order N7320 and in support of Governor Newsom's master plan for aging. A number of California's older adults live on very limited incomes, and many do not have the funds to spend on devices such as tablets, smartphones, smart home devices, etc., as well as broadband services that would allow them to remain in digital contact with their healthcare providers, their family members, their friends, caregivers, and other service providers and/or case managers. CDA's digital divide initiatives are intended to mitigate loneliness and isolation by providing older adults with greater access to resources and information. So, next slide. So CDA's initial effort to bridge the digital divide and address social isolation for older Californians and persons with disabilities was our Google Home Smart Speakers project. In January of 2021, CDA partnered with Google and received a donation of some 8,500 Google Home smart speakers that were distributed to participants in the Older Americans Act programs and the Multipurpose Senior Services program across the state. So thanks so much to Google for that amazing donation. Our next effort to bridge the digital divide is our Connections, Health, Aging, and Technology, acronym CHAT program. Through this effort, CDA has partnered with area agencies on aging to distribute at least 4,000 iPads with data plans, customized onboarding, technical support, and digital literacy training to older Californians. The purpose of this project is to mitigate loneliness and isolation for older adults, providing them with greater access to resources and information. For this project, CDA also partnered with the University of Southern California's Graduate School of Gerontology to develop tools that will evaluate the effectiveness of digital devices in reducing social isolation for device recipients. And if you know someone who would like to apply for participation in the CHAT program, please encourage them to contact their local area agency on aging. CDA is also in the process of launching a $48.5 million Access to Technology program, acronym ATT, which is a county grant program for older adults and persons with disabilities. With this initiative, we are partnering with the California Welfare Directors Association and a work group of county human service department directors. With the ATT program, counties will be able to leverage their existing programs and program recipients to provide digital devices, broadband service plans, digital literacy training, digital infrastructure to facilitate access, and outreach to bring awareness to the program. This program is also intended to reduce isolation, but also to increase connections and enhance self-confidence for program participants. We are also concurrently preparing to launch CDA's Digital Connections program, which is a $17 million program to expand on our current CHAT program but to also include participants in CDA's Multipurpose Senior Services Program, or MSSP, our Community-Based Adult Services Program, or CBAS, and the Department of Healthcare Services Program of All-Inclusive Care for the Elderly, or PACE. This program will include a purchase of digital devices, digital education and literacy for older adults. Goals of this program are to allow participants to remain in digital contact with healthcare providers, family, friends, caregivers, other service providers, and or case managers, as well as access to telehealth, which Katie spoke about earlier this afternoon. So I'll close by saying CDA will continue seeking opportunities to partner with government agencies such as the Department of Technology, the California State Libraries, and Department of Healthcare Services, and others, as well as foundations, nonprofits, and advocacy groups such as CCL-TSS, to expand access to technology and services to California's older adults and to help California close the digital divide. Thank you.
So yeah, opening it up to Q&A, please feel free to drop your questions into the chat or the Q&A feature, and we'll kind of get to those as we roll along. I think the first question I have is for you, Brian, and it's related to the Google Home Smart Speakers project. Was there a training component to that? One of our participants noted that it seemed like there was training components to DC and other initiatives, but not specifically for that one. Can you speak to that a little bit more?
Speakers. And it's a little bit of a different type of device. So it was implemented in a way to just share those smart speakers because it was a Google donation to those individuals who are identified who could benefit from them. So
that's wonderful.
Mm-hmm.
And Katie, one for you. Can community-based organizations or providers become anchor institutions? And if so, how do they go about getting that process started? Any intel on that?
Yeah, that's a great question. The answer is yes. And the way you do it is there, in each of your communities, there are these things called consortia, which are designated by the California Public Utilities Commission, and they're charged and funded to bring communities together around all of this infrastructure. So that's who the CPUC is talking to. That's who the California Department of Technology is talking to, your local consortia. So if you're in a particular region and you want to be connected to them, I'll drop, the link is actually in the presentation that I think we're probably sending out. I can also drop the link in the chat so you can look up your county and see who your consortia is, and there's an email address. But if you're in a particular area, I'm happy to connect offline and see if we have a relationship with that consortia or help facilitate that conversation. We're doing quite a bit of that in a few areas around the state.
That's great. That's awesome, Katie. And yeah, certainly I think there are people who might take you up on that offer and would love the link in the chat if you have that handy. Okay, Brian, here's one for you. Do participants of CHAT and ATT keep their devices after the program ends, or do they have to give them back?
Currently, for the CHAT program, it is the expectation that the iPads be returned at the end of the program because of state purchasing and procurement requirements. So unfortunately, basically, because the state purchased those, that is the expectation they'd be returned. But we are looking into different alternatives and ways to kind of make that looking what other alternatives we might have surrounding that. And for the AT&T program, it's a grant program, so it is a county grant program, which allows us to vest authority to the local jurisdiction. So we're just getting that up and running, but I'm not going to say, so don't quote me, but hopefully they wouldn't be subject to state rules, but they may be subject to their state, to their local rules in terms of returning the devices for the ATT program. So they'll have to look
Wonderful.
at, yeah, they have to look at their county rules and regulations.
Thanks, Brian. And a follow-up question, how and when will the Department of Aging be getting the word out to CBAS, MSSP, and PACE communities about the DC program? Any intel?
Yeah, good question. We're still in the process of implementing, designing, planning, implementation of that program. So it's still early on. We're in the process of gauging interest amongst the different parties, programs that are going to be involved. And, you know, it'll be marketed in a number of ways. One way is our CDA website, of course, will be doing everything we can to make participants aware of that program. But the individual programs themselves are going to be identifying participants and looking for individuals actively who could benefit from those programs. So it'll be a joint effort amongst CDA as well as our partners to get the word out on that.
That's great. And I want to oh yeah, go ahead, Katie.
Yeah, if I could just jump in on this devices piece, I just wanted to drop in a link in the chat here. It's with a group called Human IT, and they're an organization that actually helps assist anyone, but people who want to sign up for affordable internet. And as part of that program, if you sign up, they will give you a Google Chromebook so that they can count that someone is actually signed up. But it's a device for you. And then generally they have an affordable device program. It's what they do. And they actually get devices and refurbish them. And so you can buy affordable devices. They have lots of partnerships with education institutions. We're trying to introduce them to the health side, but I would love to see them engaged with the older adult community as well. I think they'd be really interested in that.
Yeah, thanks so much. And thanks for sharing that link in the chat. And then just a follow up to that question about the return policy. Would the CBOs bear responsibility of tracking the devices and then making sure that they are returned, or where does that responsibility lie?
Is this for the chat program? I'm not sure.
I don't think the question was specific, but I think, yeah, maybe it was for the chat.
Yeah. Oh, I see it here. Yeah. Oh, yes, for chat. Yeah. Currently, they are. We have we're partnering with the area agencies on aging for the chat program there, and they are actively tracking in conjunction with CDA. So we're both, they're tracking who they give it to, but then they inform us, provide us with that information. So we're all on the same page in terms of where the devices are. We have a partnership with AT&T as well, which allows us to access those devices, and if they're lost or stolen, we can wipe them for redistribution. So it's quite collaborative along those lines. Fantastic.
Are there any source of funds available for providers to help them improve their need for interoperability with healthcare systems, as well as overall connectivity challenges in locations with poor or inadequate access to broadband? I don't know, that's probably a Katie question, but maybe a Brian question too.
Brian, you want to talk about interoperability? I can talk about it. Hi, Lydia. Thanks for the question. It's good to see your name pop up. I'm so glad you asked the question, and it might make sense to have an offline conversation with you about all of this anyway. I would actually say they are two related but separate conversations. In my mind, broadband is going, to use a term, upstream, right? Broadband is not specific to health or to education or to jobs. It's all of them. And I'd say, but without connectivity, we can't do exactly what you said, interoperability. We can't get our health systems to talk to community-based organizations, et cetera. ITEB is actually working and partnering with a group on this specific topic that we would call health information exchange or data exchange framework. And there is some funding, I think, in the budget around this. I can double check. But also there's like a whole separate conversation that's more at the health level. So we're sort of saying you need to have broadband connectivity so we can actually do all of that good health information exchange. But I do believe there's some more money in the budget this last year to help entities stand up those systems. I don't know who's actually eligible. I imagine you probably have to, some part of your business has to serve Medi-Cal or underserved folks. But happy to follow up. I think we're putting together sort of a roundtable actually around that. There's a new data exchange framework. So Maria, put that on your list. We're following up with you on that as well. You don't know it yet, but Lydia, we might want to bring you and potentially others on this call into that conversation. Thanks.
Yeah, and it looks like Lydia's on board. She's ready to join that conversation. So I think you have her contact information, but if not, I'm happy to share that. Okay, let's see. Sorry, it's like I don't have my glasses, so I've really got to get in your face. Are any of these sources of funds that Katie or Brian mentioned available to purchase devices such as grant pads for beneficiaries? There are designated for older adults. They have been tested by UCSF and work nicely, would help greatly with remotely delivered services and telehealth access.
So I can speak to our CDA programs currently. The device that we are providing are iPads for the program participants. However, the access to technology funding is going directly to the counties, and they do have the flexibility to utilize that for to purchase whatever types of devices that they feel would be beneficial. So they have a lot more flexibility in the ATT program. So you would have to consult with your county. Your county's digital connections program to determine what devices they might be utilizing. So.
Lydia says iPads are challenging to use, and I certainly understand that as well. A question for both presenters, and I think, Katie, it looks like you may be responding in the chat as well. In Alameda County, they've completed a comprehensive digital inclusion survey, and they've captured findings that identify gaps, inequities, barriers, needs, etc., along with recommendations for solutions and action. And Wendy Peterson is asking, who do we share this information with? Is there somebody that could benefit from having those details?
Everybody. Short answer, right? But obviously targeted with that. So it's Alameda County. Definitely sharing it with your local consortium, which probably has already been done. I would share that with your local clinic association. They've got a great new executive director who came from the state association. You've got, the Alameda Alliance folks and that health system. I think definitely share it with them. I think that that's really powerful. And, there's a county hospital system that's sort of been spun off from the county. I would share it with them and then ask them to share it with all of their state counterparts. I think that that's a big way to do it. And we'd be happy to help think through that and identify some of those folks through. But that's fantastic. I would love to see it so that we can talk about it and, use it as potentially a model to suggest to other communities and really start spreading that around. In my organization, we do online policy forums and conferences. And so these are the types of things I like to know about so that we can, write down the name Wendy Peterson and know who to call when we're building that panel, when we want a really local perspective for folks who are doing this well.
That's fantastic, Katie. And I hear that baby going. So if you
I'm so sorry, everyone. He's we're trying to make it work. My husband's out getting him medication right now. So thank you all for bearing with me. Real life right here.
Yeah, real life. And all too familiar with the struggle of, being a mom, working full time and at home. So I think we've all been there at one point or another. And now we all get to see it because we're meeting virtually on Zoom. So our lives are kind of just out there.
Exactly. I think in some ways it's healthy, but also I like to make sure that, we're not all polished all the time. We try, but there's real life here as well. So thanks, everyone.
Absolutely. Absolutely. Brian, I do have a question about this AT&T, I'm thinking of the cell phone company, ATT program that you mentioned that just launched, the RFP just launched, and there's some parameters there. It seems like, and you can correct me if I'm wrong, it seems like the funding is going to go to counties and then counties subcontract. If I'm a CBO or I'm a vendor, who would I want to work with to establish a partnership? Would that be with my county? Is it my AAA? Where would I go?
Great question. Definitely you want to consult with the counties consult with the counties, and many of the counties will be subcontracting with various vendors. And it's important to let them know about the resources that your CBO has to offer. So it may be I'm sure many of the counties will be looking for resources to provide the services that they intend on providing. So definitely you want to make that collaboration, reach out to the counties and take it from there. Who in the county?
Yeah, who in the county? What departments? Is it Health Human Services? Is it technology?
I have no idea. We dealt with the county directors, the directors of the county human services departments. So that's who you want to go to, is their human services department. But I don't know exactly each person from each county who you should speak with. But I think that would be the best place to begin.
To start. That's wonderful. Thank you so much. That's really
Yeah.
helpful. And I'm not seeing any additional questions, but I do want to just pause and see if folks want to raise their hand and jump into the conversation. Chat Q&A, I'll keep my eyes peeled. And if not, we'll give folks some time back on their calendars. Absolutely, this session's recorded, and so we'll post that and we'll make it broadly available. We'll promote it on Twitter and other places. Katie, feel free to share with whoever wants to watch this as well, and Brian. And with that, just giving one more quick look over. Okay. Well, thank you both so much for such a fantastic conversation. And Katie, we'll let you get back to motherhood. I appreciate you taking the time to be here and juggling today for us. Brian as well, I think it's exciting to hear about all the work happening at the Department of Aging and some new opportunities on the horizon. I know we've got partners at the collaborative who are kind of on the edge of their seats waiting for RFPs and things to hit and really understand how they can play a role in closing that digital divide as we move forward.
Yeah, I just want to say thank you for inviting me today. I always learn something new. Katie shared the information about the digital redlining, which was pretty eye-opening to me. So thanks for sharing that, Katie.
Yeah, thanks, Brian. I'll send you more information on that. The California Public Utilities Commission did a whole proceeding on it, and there are lots of comments and more information out there too. So yeah, it's and the federal government is now looking at it as well at the FCC. So it's real. But
wow. Very interesting.
And Katie, before you jump off, are there any upcoming opportunities to plug in with, broadband council discussions or any other stakeholder opportunities that are coming up? I know you mentioned the fall being a time frame for some of that process to kick off, but if somebody is just eager to plug in before then, what would be a good next step?
Yeah, so a couple next steps. One, continue talking to me and Brian. Excellent. Brian and the team have been amazing and are really highly engaged, not only here, but behind the scenes. So they've been a great resource to me and I've learned so much. If you have questions, I definitely dropped my email in the chat. I'm sure Maria will make that available. I'm happy to talk more specifically if you have questions or if you want to get engaged in your particular community, and we can try and help connect you. We're doing a lot of that work. But two ways that you can specifically engage, and Maria's great with the softball questions, so thank you for that. The California Broadband Council meets tomorrow morning at 9:30. It's virtual, and they tend to have both a written comment and a verbal comment option. They will be talking about the state digital equity plan that I mentioned in that whole stakeholder process, and there should be a public comment period. So what we're asking anyone who wants to go to those meetings right now is just identify yourself, talk about who you represent and why this is important to you and that you want to be at the table. I think that that's actually the most important thing for them to hear, because they're not hearing a whole lot from health and human services organizations or even just individuals who are interested in this. So I think that that's actually the most important thing, is to raise your hands and say, hi, we're here, we're interested, please include us. And that opportunity is tomorrow at 9:30 a.m. and the link is in that PowerPoint that I gave you. So
awesome. And I'm hoping Nancy can help us dig it up and put it into the chat just so folks have that on their radar.
I got you.
Oh, perfect. Thanks, Katie. And thanks so much, Brian. And I think we'll just pivot to closing remarks. Closing remarks are short and sweet. I just want to do a quick announcement. I'm sure you've seen it. The Department of Aging has been firing these off, but we have the California for All conference coming up on September 20th. If you haven't had a chance to register, please do that, because Registrations are coming in quite fast. It's been open for a little bit over a week, and I think there's only 130 seats left. We do have to, tap out soon. So please be sure to register. If you are part of the Regional Coalition Network, please note that per your contract with the SCAN Foundation, you do have to send at least one representative. So you want to make sure to sign up earlier and not get left out. It is first come, first serve. And certainly if you have any questions about that, please let me know. I'll drop that link in the chat. Again, just a quick reminder to register if you haven't done that already. This is an event that will be in person in Sacramento on September 20th. Our first time getting together, I think, since the pandemic, so really exciting. I know there's going to be some COVID procedures in place. Hopefully folks feel safe enough to come and join us in person. And other than that, thank you so much for joining this webinar. Be on the lookout for the slides and the recording. And I think we'll kind of compile all of the different links in the chat too and make that available just so it's easy to access. And with that, I hope you have a wonderful rest of your Thursday and look forward to connecting with you soon. Thanks, everybody.
Thank you. And thank you, Muffy.
Yeah, thank you. Very cool. Thanks, everyone. Thanks again for having us. Bye.
Bye, everybody.
See you.
Bye.
Bye.